New at 11, a state lawmaker says he is now taking action after a WCNC Charlotte investigation found when gun owners apply for concealed carry permits in Mecklenburg County, Sheriff's Office background checks sometimes turn up sensitive health information. Now, this includes whether a person's had an abortion or a sexually transmitted disease. That legislator told our Nate Morabito Sheriff's Office employees have no business accessing these records.
When you apply for a gun permit, the door is open for the release of your health records. When you sign this form, right then and there, you give the Sheriff's Office the right to review your history, so the agency can make sure you're capable of safely handling a gun. But sometimes those background checks also return sensitive medical records. A state lawmaker is now ready to close that door.
Let me get a couple of earplugs in here. You have to protect yourself.
People who do the right thing and follow the law so they can legally conceal their guns.
Fire in the hole. I have to protect myself and mine. That's the American way.
Have opened themselves up to what some call a violation of their privacy.
It's entirely too much. It's invasive.
Attorney Ron Shook settled a lawsuit with the Mecklenburg County Sheriff's Office in 2024 after the agency failed to issue concealed carry permits in a timely manner. During depositions for that case, an MCSO employee detailed a wide range of records they've received from health providers during background checks, like how many children someone has, whether a woman's had a C-section, and more.
Has a person had an abortion? Do they have any sexually transmitted diseases?
The employee admitted providers sometimes hand over records the Sheriff's Office didn't even request. Their words have continued to worry Shook.
Really invasive personal information that the sheriff doesn't need in order to make a decision about whether or not they should be able to carry a firearm.
Thank you for bringing this to my attention. I'm going to do what we can to resolve the issue.
Representative Keith Kidwell is a gun advocate.
That's blatantly none of their business and should not be provided.
The Eastern North Carolina Republican has sponsored legislation in the past aimed at eliminating the concealed carry permitting process altogether.
Anything that goes beyond the necessity that the sheriff or sheriff's deputies would need to make that decision is invasive in my mind.
Since permits are still required to this day, the lawmaker intends to file legislation that, if passed, would limit the kind of records sheriff's offices can receive during background checks.
We've got to do everything we can to control that.
For its part, the Mecklenburg County Sheriff's Office told us the agency has no control over what health information providers choose to send. In a statement, a spokesperson said sometimes hundreds of pages are sent. Other times, only a few pages. She added, even records from providers not specializing in mental health, such as an OB/GYN, may be relevant. For example, discussions about an abortion might indicate severe depression or suicidal thoughts, raising concerns about the applicant's ability to handle a handgun safely. Another 2024 deposition involving a different MCSO employee backs that up, noting the agency has received pregnancy-related records when there's a link to depression. Two existing state laws seem to muddy this even more. One only allows for the release of records related to mental health or capacity. The other requires the sheriff to consider any physical or mental infirmity. Representative Kidwell hopes his legislation clears this up. Nate Morabito, WCNC Charlotte.